So I think caregivers are family caregivers, so people, family and friends who look after people with chronic illness, whether it's acute or long-term, are really the foundation of our healthcare system. But despite being the foundation and providing an estimated nearly 40 billion hours of unpaid labor or care every year to look after these individuals, they really go unrecognized in our healthcare system. They are economically invisible and they're also politically invisible. So I think the absolute first step to actually improving our healthcare system with caregivers in mind is actually recognizing the efforts that they do every day. And when you have recognition, what comes with that is better support and better integration of caregivers within the healthcare system at all levels. So whether that means on the inpatient setting, across transitions of care, or in community settings, caregivers need to be recognized and integrated as part of healthcare delivery, and we need to start seeing caregivers as integral members of the healthcare team and not just sitting on the sidelines. So I think beyond recognizing them, I think what we need to do is actually start to translate some of the research that's been done into practice. So I think there's an abundance of research showing that caregivers are providing complex and intense care. There's an abundance of research showing that there are potential negative consequences to caring, whether that's related to their physical health, their mental health, or long-term economic insecurity related to taking on family caregiving responsibilities. But the next step is actually disseminating and scaling up the effective interventions that have been developed for caregivers and integrating them within our healthcare systems themselves. I'm not sure that we need a lot more research specifically on demonstrating all the harms of caregiving, but what we really need to do is take these pockets of excellence where we know that there are programs that can help these caregivers and make sure that healthcare systems and really larger society starts to value this as an issue and puts both political will towards this as well as finances committed towards programs that can better support caregivers.